okay, one of the most common mental health disorders, I would say, that I come across is depression. Mm-hmm. Oh, I have depression. Oh, I'm on medication for depression. There's anxiety as well, but depression seems to be so commonplace now.
Yeah.
What exactly is it? How do you diagnose someone with clinical depression as opposed to someone is under tremendous stress for whatever reason, and they're just stressed and depressed and sad about their situation, and then that sadness eventually goes away? Now, clinical depression, though, is not like that. It's not going to go away on its own unless some intervention has been made. Am I correct?
Yes, yeah, you're correct. Although actually episodes of depression do and should eventually remit themselves, even if there was no intervention. The difficulty is that for some people, they develop suicidal ideation in the context of being depressed, and there can be risks if they're left untreated in terms of profound hopelessness and suicidal thoughts or intent. But a diagnosis of depression really just comes from a symptom list. So you have to have had symptoms for a certain duration. It's sort of 2+ weeks, and then you would look for biological symptoms, so sleep disturbance and reduced appetite and poor energy levels, poor motivation, poor concentration. Some people present with a very agitated form of depression, where they're just highly agitated and unable to function, and that tends to be at the more severe end of depression. And again, you can develop psychotic symptoms in depression too when it's very severe. So people can sometimes believe that they're already dead and no longer alive, or experience auditory hallucinations, for example.
Mm-hmm. And is it common to see weight gain in people? So, I mean, if insulin resistance is the underlying cause of many of these mental health issues, then I would assume weight gain would follow insulin resistance, although it doesn't always. But do you notice that? Because a few people that I know who've been diagnosed or on medication for depression, they're just starting to gain weight, and I just want to look, try the ketogenic diet. Look,
that might be partly medication. So some of the antidepressants can cause weight gain, not all, but I think even some of the ones that we think don't cause weight gain, there's evidence that they can actually lead to people gaining a fair amount of weight. I think what I would see is usually when somebody's very depressed, they would lose weight during an episode of illness, unless they have an atypical presentation. So you do have some people who eat more when they're depressed, although we would consider that to be atypical. But I would say that the general health of the population isn't great to begin with. And so your average person is likely dealing with central obesity or being overweight and running the risk of high insulin levels, and eventually be on their path to insulin resistance. So yeah, I mean, I think of depression as an inflammatory condition. So there's certainly a cohort of people who have raised inflammatory markers, and we know already why inflammation would trigger off changes in neurotransmitter pathways in the brain, and inflammation in itself involves an immune system response, and even these immune molecules can trigger off inflammation in the brain, and so there's just many different mechanisms that can underlie depression.